Hello everybody, my name is Hannah Keppen and today I will be teaching you about contraceptives. Contraceptives are also known as hormonal birth controls. To start off, we've got our goals and our objectives listed on the second slide. We have 2 goals and 2 objectives. Our first goal is to increase the knowledge of hormonal birth control and its benefits for teenagers, specifically teenagers ages 14 to 18 who are sexually active. Our second goal is to increase the knowledge of the appropriate use and effectiveness of each hormonal birth control method. And then we have got our 4 objectives listed. Our first objective is by the end of the presentation, 90% of participants will be able to explain how hormonal birth control can prevent pregnancy. Our second objective is by the end of the presentation, at least 90% of participants will be able to list at least one hormonal birth control method based on their effectiveness. And then we have our third objective, and that's by the end of the presentation, at least 90% of participants will be able to list 5 side effects of hormonal birth control. And then we have our final and our fourth objective, which is by the end of the presentation, at least 90% of participants will be able to list 3 hormonal birth control misconceptions. To introduce hormonal birth control, it is also known as a contraceptive. The definition of hormonal birth control or contraceptive is defined as the intervention that reduces the chance of pregnancy after sexual intercourse. All hormonal birth controls have 2 different hormones in them. Well, all of them have one hormone, which is progestin, and progesterone is the natural form of progestin. And then only some hormonal birth controls have estrogen in them. These hormones work together in hormonal birth control and contraceptives to prevent pregnancy by suppressing a woman's ovulation. Hormonal birth control has been used by millions of women since the 1960s to safely protect their reproductive health. The first contraceptive to be approved by the FDA was the oral contraceptive, also known as the pill. What are the different forms of hormonal birth control? Well, the first form we're going to talk about today is the oral contraceptive. The oral contraceptive, as we discussed, is also known as the pill, and it was the very first form of birth control that was invented and released in the 1960s. There are 3 different forms of the pill. It's also the most used today. The first form of the pill is the cyclic combination oral contraceptive. The second form of the pill is a cyclic combination oral contraceptive, the extended use. And the third form of the pill is the progesterone-only pill. There are a few advantages to the pill. These include rapid reversibility. It regulates menstrual bleeding. It decreases menstrual blood loss. It decreases menstrual pain. It decreases in frequency of menstrual migraine, and it decreases endometriosis symptoms, as well as decreasing premenstrual symptom, which is also known as PMS. It decreases ovarian cysts, and it decreases the risk of ovarian cancer and decreases the risk of fibrocystic breast changes and cysts. Now, there are also some disadvantages of taking the pill. The pill is taken daily. If somebody is not able to keep up with the daily dosage of the pill, then this may not be the most effective method of birth control for them. I always encourage individuals and women to talk to their physicians and gynecologists when deciding the best method that might be the most effective for them. The second form of hormonal birth control is the patch. The patch is a thin piece of plastic that is placed on the skin, and when the patch is placed on the skin, it releases hormones through the skin. It is replaced every week, and it's usually placed on the buttocks, the arm, the abdomen, or the upper torso. The advantage of the patch is that it's kind of convenient. You can just stick it on your skin and let it do its job. The disadvantage of the patch is that it can cause some skin reactions, as well as breast discomfort, headache, and nausea. The third form of hormonal birth control we're going to talk about today is the ring. The ring is similar to the patch, as it's also a thin piece of plastic. The ring, however, though, is placed inside the vagina for 3 weeks, and then is followed by 1 week with no ring. There are some advantages to the ring, as it's more convenient than both the pill, which is taken daily, and the patch, which is replaced every week, as you really only replace the ring once a month. The disadvantage of the ring, though, is that it can cause some vaginal discomfort, as well as nausea, breast tenderness, or changes in libido. And it also has an increased risk of blood clots. The fourth form of birth control that we are going to talk about today is the shot. The shot is also known as the injectable contraceptive. This form of birth control is injected every 1 to 3 months, and it only contains the hormone progestin. The shot, however, can be reversed, which is an advantage to having it, but the side effects of the shot will last until the last injection wears off. Some other advantages of the shot or the injectable contraceptive include absent or light bleeding, decreased cramps and PMS symptoms, reduced endometriosis pain, and a reduced risk for pelvic inflammatory disease, which is also known as PID, and endometrial or ovarian cancer. Now, the disadvantages of taking the shot or the injectable contraceptive include unpredictable bleeding, depressive episodes, weight gain, and a loss of bone density. The fifth form of hormonal birth control we're going to talk about today is the implant. The implant is the most effective form of hormonal birth control on the market today. It is a thin rod that is placed in the arm every 1 to 3 years, and it is only contains progestin or progesterone. The advantages of the implant is that it is convenient, it is discreet, it decreases menstrual pain, it's reversible, and it's cost effective for most women who are looking for it. And there are some disadvantages to the implant, though. Implanting into the skin may cause some swelling, bruising, and pain in your arm, as well as unpredictable bleeding, headache, weight gain, acne, breast pain, and a reduced interest in sex. The last and final form of hormonal birth control that we're going to talk about today is the hormonal IUD. The hormonal IUD is a small T-shaped implant that is placed inside of the uterus. This form of birth control is highly effective and also only contains progesterone, and IUDs can last from 3 to 7 years in total. At this point, you would want to get it replaced. There are some advantages to the hormonal IUD. It's convenient, discreet, reversible, long-lasting, it reduces period pain, and it also offers protection against PID, pelvic inflammatory disease. The disadvantages of the hormonal IUD include unpredictable changes in menstruation, cramping at the time of insertion, and some concerns about weight gain. On this next slide, I've got an image that has 6 different pictures. Each of them are a different method or form of the hormonal birth control or contraceptive. The first one in the top left corner is a picture of the pill, and then the next one following that is on the implant, and then the one image in the top right corner is the injection. And then on the bottom, you have the contraceptive patch shown, the vaginal ring shown, and the IUD shown. What are progesterone and estrogen? Well, progesterone and estrogen are both considered steroid or lipid hormones in the body. All hormonal birth controls or contraceptives contain progesterone, but only certain hormonal contraceptives or hormonal birth controls contain estrogen. What are the risks of taking hormonal contraceptives or birth control? Well, birth control is still a drug that needs to be prescribed by a medical professional. Therefore, it also has its own risk and side effects. Unfortunately, birth control is not a drug or a medication that you can simply go to the grocery store and buy off the shelf. You must get it prescribed through your physician or your gynecologist, in which you will need to make an appointment where you can discuss what you are looking for and which form or method of birth control would be best suited for your lifestyle. Some of the risks that increase when someone is taking hormonal birth control include an increased risk of metabolic changes, breast cancer, and mood depression. Hormonal birth control can also affect the body. One of the main organs that it can affect is the liver in the body. When the hormonal birth control affects the liver, it can also cause a woman to gain weight. This can be a side effect. To counteract this, physicians will advise their patients based on their hormones and the birth control method that they have chosen to use. There is also a risk of breast cancer that is increased by the progesterone and the estrogen hormone levels in birth control. Although studies have shown that progestin-only contraceptives have a lower risk of causing breast cancer. It has been proven that hormonal contraceptives do impact the brain function as well. They play a major role in changing someone's mood, positively and or negatively. Both progesterone and estrogen affect not only the brain, but also the central nervous system. In doing this, the brain can release an antidepressant effect. It's very important that when you meet with your physician to discuss the risk of taking contraceptives. What is the history of hormonal birth control? Well, the first hormonal contraceptive was introduced in the 1960s. The first hormonal contraceptive was an oral contraceptive, also known as a pill today, and it was called Novib. And within 2 years of its initial distribution, 1.2 million American women were using the birth control pill. The research that led to the pill and the first oral contraceptive was conducted and introduced by Dr. Gregory Pincus and his team of medical team. Below this is a picture of the pill package and all the pills that would be distributed monthly to the American women. There are many advantages of taking hormonal birth control. These advantages include the fact that it's cost effective, it reduces bleeding and cramping, it has a reduced risk of PID, pelvic inflammatory disease, it prevents pregnancies, it can reduce acne, it can reduce ovarian cysts, and it also can reduce symptoms of endometriosis. It protects against ovarian and endometrial cancers, and it has a reduced symptoms of premenstrual dysphoric disorder, also known as PMDD. But just as there are advantages, there are also disadvantages of taking hormonal birth control or contraceptives. The disadvantages include hormonal contraceptives may not always protect against sexually transmitted diseases, also known as STDs. The hormonal contraceptives can cause irregular bleeding or no bleeding at all. Hormonal contraceptives, specifically the pills, can be affected by other medications, so you want to make sure that you're not overlapping medications that may cause the effectiveness to weaken in the pill. Hormonal contraceptives may increase risk, such as breast cancer, specifically ones that have the hormone estrogen in them. Hormonal contraceptives also have an increased risk of blood clots, and they have an increased risk of stroke and heart attack. How is pregnancy prevented with hormonal birth control? This is an important topic to discuss, as one of the main reasons many women take hormonal birth control or contraceptives is to prevent pregnancy. Well, birth control works to prevent pregnancy by preventing ovulation or suppressing a woman's ovulation, thickening the cervical mucus, and then thinning their endometrium. Ovulation occurs every month when an egg is released from a woman's ovaries. Progesterone is a hormone in birth control that signals the body and the ovaries not to release the egg each month. Without progesterone, every woman would release an egg every month, causing us to ovulate. When cervical mucus is thickened, it does make it difficult for the sperm to enter the cervix. If the sperm cannot enter the cervix, then they will not be able to enter the uterus. And then the endometrium is also known as the uterine lining. If the sperm does make it to the egg and starts the fertilization process, then this will prevent the egg from implanting in the uterus. All these work together, the hormones affect these and working together to prevent a woman from becoming pregnant. What are the common misconceptions with hormonal birth control? It's important to remember that every woman should do their own research and speak with their primary care physicians and gynecologists on the different hormonal birth control methods that are available to them, as well as the risk, the misconceptions, the side effects, the advantages and the disadvantages on which method would work for them and their lifestyle. Here I have listed some common misconceptions of hormonal birth control. The first being that birth control causes women to become infertile. This is simply not true. The second misconception is that birth control causes weight gain. Although studies have shown that minor weight gain is a side effect, it should not fluctuate heavily. If a woman fluctuates heavy in her weight gain, coming on or going off birth control, then they should speak with their physician or their gynecologist on this side effect and how to ways that we can change that, or if they should change to another form of hormonal birth control. The third common misconception is that birth control prevents sexually transmitted diseases. This is not true. Unfortunately, birth control will not prevent a woman from contracting a sexually transmitted disease. On the contrary, it can help with PID, pelvic inflammatory disease, and PMDD. Another common misconception is that birth control is only used to prevent pregnancy. Nope, birth control has many uses, and one of their main uses is actually to help women balance out their hormones. What are the common side effects of hormonal birth control? Well, there's many common side effects. I only have listed a few here, though. One of the common side effects is weight gain. This is mainly a side effect of the implant, the hormonal IUD, and the oral contraceptive. Weight gain should not be significant, but it also may encourage women to discontinue the use of their contraceptives. This is another reason why it's important to discuss the side effects of hormonal birth control with your physician. The next common side effect I have listed is the mental health or mood changes. A systematic review of neuroimaging studies has documented visual changes of the use of hormonal contraception, mainly in the areas of the brain involved in emotional and cognitive processing. Hormonal birth control has been shown to have a relationship with depressive moods. If you are taking a hormonal birth control and you notice that depression is a symptom that comes along, I would speak with your physician about that. Another common side effect of hormonal birth control is a reduced sexual desire. In a large study of oral contraception and sexual function, the pill users had lower scores on desire, arousal, orgasm, lubrication, and satisfaction. Another common side effect of hormonal birth control or contraceptive is changes in menstrual cycles. Some birth control methods can cause women to bleed more often, while others might completely take away a woman's period. Another common side effect that I have listed for hormonal birth control is an increased risk of cancer. The synthetic hormones in birth control, the progesterone and the estrogen, have been shown to cause breast cancer. I would discuss which forms of birth control is highest for causing breast cancer with your physician and go from there based on the risk and the benefits. I have another slide. This slide is a list of other side effects that I did not speak on in the last one of hormonal birth control. These side effects include a reduced libido, headaches, vaginal dryness, impact on fertility, synthetic hormones that can disrupt the body, breast tenderness, nausea, bloating, and increased blood pressure. If any of these side effects bother you, I would make a list of them and bring them to your healthcare provider. On this last slide, I have listed all of the references that I have used to get all the information on hormonal birth control and contraceptives in this PowerPoint. Thank you so much for letting me share this with you.